were worried basically because of things that they'd read online.
Phil McCann there. Well, we can talk now to Dr Zubaida Haque. Dr Haque is a member of the group that established itself as an alternative to the government's official scientific advisors, calling themselves the Independent SAGE Group. Dr Haque, thank you very much for joining us today. And you've been very clear in your criticism of the timing of the UK government's decision to restrict travel from India. Now that this particular variant is here in around 86 areas, council areas, we believe, what can you say from what you know so far about how easily it's transmitted?
Well, we now know that it's about 50% more transmissible than the Kent variant. And as you've said, it is rapidly spread across the country in less than a month and a half, really. In the last 6 weeks, it's been doubling every week. Last week, it tripled. So the cases are growing exponentially all the time, spreading far and wide, and we've got 86 areas with a minimum of 5 cases. So this is a huge problem. And can I say, Anita, it is a decoy and a distraction to focus on vaccine hesitancy at the moment. I know Matt Hancock has said that the hospitalizations in Bolton suggest that this is a vaccine hesitancy issue, but really that evidence is so poor. It's based on 18 hospitalizations in Bolton, of which up to 12 people haven't taken the vaccine when they've been offered, but we don't know why. It could be medical reasons. But we know a third of that group, 6 people, have taken the vaccine. So this is not a vaccine hesitancy issue. This is about the fact that the government have left open the border and that quarantine is extremely poor and porous, and because there is no virus suppression strategy to stop this variant from spreading across the country.
OK, a couple of things that you said, let's explore those. So in terms of susceptibility to the virus after the vaccine, as opposed to someone who has not had the vaccine for whatever the reason, and obviously there is a political argument about that, which we're not going to get into too much because we want to focus on the science. I mean, the previous guest that I had said there was some evidence that if you have had the vaccine, it was actually stopping you from contracting this variant. There's obviously the issue of reducing ill effects of the virus, but is there any evidence that if you have the vaccine, it actually stops you contracting this variant?
There's some evidence, but I think the real concern here is that the evidence is still emerging. We've got the odd study that's showing that the vaccines are effective to some extent. We have to remember that even though it's much better to take the vaccine than not to take the vaccine because it reduces severe illness, the vaccines are still not foolproof. You know, there's still room for people to become infected with this virus and to spread the virus, whether it's the so-called Indian variant, the South African variant, Brazil variant, or the Kent variant. There's still some room for that. But the biggest issue here is there is no strategy to suppress the spread of this variant. And I think that's the really huge concern.
What would you like to see in terms of strategy right now? Because whatever that strategy is going to be, it needs to be put in place pretty quickly, doesn't it?
Absolutely. So the first thing we want to see is travel to be completely restricted, only to a needs-based travel. Leisure travel should be restricted. It shouldn't be allowed right now. The government didn't pass their 4 tests on the roadmap, especially the test around the risk assessment on new variants of concern. We failed that test, but the government have gone ahead. So they need to close that border. We need strong quarantine for everybody, regardless of whether they come from a red, amber or green country. We need a robust test and trace that's locally driven, that will trace everybody who has this variant. And we need to support self-isolation, because at the moment that's still incredibly weak. It is the weakest part of the government strategy. And frankly, no matter how much you put forward tests or do surge testing, unless you help people to self-isolate, including in accommodation for multi-generational households, people are not going to come forward for this test. So we want to see all of that, and we want to see a limit on indoor mixing. Right now, Anita.
Sorry, go ahead, Dr. Haque. Just finish that thought.
Sorry, I was going to say right now, Anita, because we've gone ahead with the third stage of this roadmap, the government have created the perfect conditions for this variant to spread. And that's because they've allowed travel to go ahead. They've allowed more indoor mixing. We know that approximately 97% of transmission happens indoors. Now, why they wouldn't limit that, why they would get rid of face masks in secondary school classrooms and corridors when there was no real evidence that children minded wearing that. We know it's effective. We know it's keeping cases down in schools. Why they've done all of that, which goes against the evidence, which goes against the risk that's being posed by this so-called Indian variant, is completely unfathomable. And frankly, it's dangerous. And the government need to pause right now and put in much more mitigation measures, including limiting indoor travel, indoor mixing for just the next 2 or 3 weeks until we find out more about this variant.
Let me come in on that point on younger people, school children, young adults. Singapore is one of the countries which has expressed concern about transmission of the virus amongst younger people, children. We heard from the Director of Public Health in Bedford earlier today, who said there seemed to be a pattern of transmission amongst children, those children returning home, the transmission then spreading around their families and more widely into the community. You mentioned the issue of wearing masks in school. What more needs to be done, do you think, specifically on looking out for this variant in those younger age groups?
Well, I think that's why we're concerned about hospitalizations increasing in the next few weeks, because we know from India that this variant has affected younger groups. We know it's an issue in multi-generational housing, and that crosses, all communities, but is particularly more accentuated in some of the Black and ethnic minority communities. We know that this virus does spread in those conditions and that it affects younger people. So vaccines need to be rolled out very quickly. But on top of that, in order to keep younger people safe, we need more mitigation measures in schools. Face masks are not enough. The government hasn't improved ventilation. It hasn't created more spaces so that children can space out in a socially distanced way.
Well, clearly schools are trying to do that, aren't they? Schools are taking the lead on that themselves in terms of encouraging pupils to still wear masks and spacing them out where they can.
Yes, and my children have said the same, that their schools have still suggested that they can wear masks. And of course, most of the children are wearing the mask despite the government's guidance saying you no longer need it. And that is the most astonishing thing, that here we have failed test 4 of the roadmap, and yet the government have gone the other way with relaxing all the public health safety restrictions rather than tightening them.
Is there a balance? Is there a balance, given how well advanced the vaccination programme is, however? Is there a balance to be struck with people's mental health, the need to return to some of the norms that we love in society, meeting up with friends and family, and also, of course, the economic argument?
Well, absolutely. And I think certainly if the government's going to limit indoor mixing, then it should help all businesses that have just opened, that have been really economically affected, hugely economically affected in this pandemic. The government should financially support those businesses if they do limit indoor mixing for the next 2 or 3 weeks. But I want to say this, that unless the government just reverse some of the relaxation measures right now, unless they put just a few limits. We're not talking about going back into lockdown like we have been in the last couple of months. Unless they do that, we will go back to a national lockdown. We will be facing surges in hospitalizations, the same in January, if not more. And that's not just my word or Independent Sage's word. That's from the government's own scientists in SAGE, who have modelled for this and said that if the government carry on the way they are with all the relaxed measures, even if the vaccine is effective against the B1617.2 so-called Indian variant, we are still looking at high hospitalizations. So the government need to act now. They need to learn that lesson now.
Dr Haque, we must leave it there. Thank you very much for your thoughts today. Dr Zubaida Haque, member of Independent Sage.